my name's Keely Chambers and I am part of the Kettering Community Midwives team. This short video follows on from the latent stage, so watch that first and then watch this. So this is all about the established labour. So what is established labour? So this is now where you are on your special birthing day or night, and your contractions or your surges have now become very regular, so regular you can set your clock to them. So they're coming frequently, so probably every 3 to 4 minutes, and each one is gradually getting more powerful. They are getting slightly closer together and slightly longer. So by this time you're probably going to be about 3 or 4 centimeters dilated. And what I mean by that is the opening of your cervix has gone from long to thin, and that is now starting to open. So this is the opening of your uterus. Yeah. So, and it's probably about 3 or 4 centimeters by this time. You're getting about 3 contractions in every 10 minutes, 3 or 4. And like I say, they are regular and they are progressive. Hooray. So what do? Do you call the delivery suite? Well, not necessarily. If you're doing okay, stay at home for as long as you can. Have a bath. Do all those things that are discussed in your latent stage until you get to the point, and you will get to a point where you need somebody to just give you a bit of reassurance or maybe discuss whether it's time to go in. So if you're getting panicky or you're getting any concerns, just call Delivery Suite on 01536 492878 or 492879, and then they can discuss what's going on and whether it's time enough for you to come in. Now, there's no harm in taking a paracetamol and having a long bath, because actually paracetamol is a really good analgesia for pain for the uterus. So please do not get offended if anybody suggests that, because actually it does really work really, really well. And if you get in a long bath, stay in there for as long as you can, and it just helps you to relax and release your own sedatives, your own analgesia, and promotes labour to start and progress well. So you've got your regular contractions, they're getting more intense. You're now starting to think, oh, do I need to speak to somebody or not? Now, if you're thinking, is this or is this not, then probably it's not. So you will get to a point where you think, yes, I do need to speak to somebody, and that is the time to ring in. And you ring into Delivery Suite. So what do I take when I go? So maybe I've been invited to go in now. So what do I take? So you're going to need your notes and your handheld notes, and you're going to need your bag that you've packed. Some stuff for your baby and some stuff for yourself, and some things for your partner like snacks and drinks. So we can give you food, water, but anything else, and tea and coffee, but anything else you're going to have to bring along. And it's always good because you're going to do a hard day's work or a hard night's work. So it's probably a good idea to bring some sugary stuff. So all the way through your pregnancy, we're sort of saying, keep the sugar low, keep the sugar low. But now, as long as you've not got diabetes, it's like, go for it. So those muscles are going to need a lot of fuel. So you're going to be working quite hard, yeah? So your body has now amazingly made and grown this baby. Now it should be able to birth it. It doesn't forget. Mother Nature's really, really clever. So, but it is going to need a little bit of help. So also what you could take in as well, you want to make your room your own. So when you get to the delivery suite, what will probably happen, they'll assess you. And if they think, yeah, you're right, you're in established labour, we're going to give you a room on your own so you've got your own privacy and dignity. And then that room is yours until you've had your baby. Once you've got your own room, make it your own. Turn down the lights. We are animals. We don't need to be in bright lights. Remember, we need to produce as much endorphins as we can and reduce the anxiety hormones, because they're going to interfere with our labour progressing well. So reduce the lights. Bring in a MP3 player and maybe some of those little tiny speakers, and that will also block out the noise of the ward, so anybody coming past with the trolley, any chatter outside, so you can have this, make this lovely sort of environment for yourself. Have lots of relaxing music on your playlist, and if you do hypnobirthing or yoga, have those relaxation tracks on there too, to just remind you and help you along. So you can move the bed out the way. You don't have to use the bed. You can ask for birthing balls, you can ask for cushions, bean bags, you can ask for mats. You can bring in your own pillows, blankets, whatever you need to make your room as comfy and as relaxing as possible. Obviously, because of the oxygen that's piped into the rooms, you can't bring candles in, but you can bring those little fake candles to make a little glow. So just have a little think how you can sort of make your room your own. Okay, so we will be monitoring you quite closely, and once you've moved into that room, we aim to have one midwife stay with you. Now obviously labour can take a long time from start to finish. On average, sort of for a first time mum, you're talking about a good 16 to 17 hours. Now that doesn't mean you're going to be in the heights of the most intense part of labour for 16, 17 hours. It's not like that at all. It's a gradual build. And the more you open up and the closer you are to your baby coming, obviously the more intense it's going to be, and the more you're going to have to focus and use maybe your breathing and whatever else you would like to use to help you along the way. And there will be a video all about all the different analgesics that you can use. Maybe you might want to get into the pool. And if you do want to use the pool, and if that is your birth plan, that you would like to use water, then do tell the midwife when you ring up initially, and then they can hopefully prepare the room for you so it's ready for you for when you come in. It might be a good idea, if you are thinking of water, to just buy a cheap old big bath towel. So one that you don't mind, if it gets a little bit dirty or if it needs throwing away. So when you get out the pool, you can wrap yourself up and make sure you're nice and warm and cozy with a big comfy towel rather than a smaller hospital one. Okay, we will monitor you all the way through your labour, and like I said, we aim to do one-to-one care. Now one-to-one care means that you'll have a midwife with you all the way through, and hopefully that will be the same one, but you have to bear in mind that a shift may change and that midwife might have to swap for another midwife, but she will be with you in the room for the main part of your labour. We will listen to baby and monitor baby, make sure baby is happy all the way through your labour, and if you are low risk, we'll just use the same little monitor that we use when you go for your antenatal checks, and we'll do that about every 15 minutes in this first stage of labour, this bit before you get to the pushing stage. It'll be about every 15 minutes. If for any reason you develop any concerns, the midwife's concerned at all, you might need to go on continuous monitoring. Or maybe you've had problems in your pregnancy and they think you're more higher risk of, developing issues throughout your labour. So it might be then, again, that you might need to stay on a monitor continuously. Now, we do have monitors that you can move around. So as long as we can get a good tracing, so as long as we can keep the contact so we can hear the heartbeat all the while, there's no reason why you can't use one of these monitors where you can go move around. Also, the benefit of those monitors, you can use them in the pool as well. So the movement is so important, and if you watch women naturally birth, they will naturally move around. And when we go into hospital, we do not want to go into patient mode because you're not sick, you're having a baby, and that's a normal, natural thing to do. So you want to keep moving, and you want to keep that pelvis moving to help the baby negotiate all those twists and turns and all those little knobbly bits and the different muscles and ligaments and things that it has to do, and what you're perfectly designed to do. But you do need to move around. So if we are upright and leaning forward, we are making a lot more room in our pelvis and really helping our baby. If we are lying down on the bed, especially if we are lying semi-recumbent or on our back, everything gets squished, so we're making less room, so it's more difficult for that baby to negotiate the pelvis. So we want to do our very, very best to be upright and moving around, even if that just means leaning over a birthing ball, wiggling our bottom, moving backwards and forwards. If you're on the bed, you can be kneeling, you can put the back of the bed up, and you can lean on the bed. So there's lots of, use your imagination on how you can keep mobile. And then use your partner maybe to lean on. Maybe if you want to squat for a bit, because that is the best way to get a baby right down low, then maybe you can get your partner to sit behind you and you can just put your elbows on their knees and squat, and they can support you. Or if you're in the pool, the water will support you. So there are certain ways how we sort of manage and measure your progress. One of them is we'll be feeling your tummy, and this is like every 3 to 4 hours. And we'll feel your tummy and we'll see how far baby's gone down in the pelvis, and we will see how the baby's rotating in that pelvis. And the other thing that we can do is we do an internal. So this is quite an intimate examination. So always be aware that you are in control. So if you want the midwife to stop, if you want to, them to slow down, if you want more explanation, please do ask. And it's very important that you do ask. You need to stay in control and be involved with every decision. So, ask. We don't mind at all. In fact, we love it when you ask us questions. Normal progress, well, we're looking for that cervix to open up at least 0.5 centimetre an hour. So, but usually labour goes in spots and spurts. So it might be that it's very slow to start off with, and then it quickens up, and then it might be a bit slower again, and then quicken up. But we do expect at least 0.5 centimetre per hour. And we do expect the baby to rotate and move down as well into the pelvis. So you can help by keeping yourself as relaxed as possible. So think, what relaxes you? Yeah? No for the gin and tonic, not at this stage, maybe later after the baby's born. But what you need to do is move, you need to breathe slowly. Like I say, maybe use that ball. Maybe you can get your partner to massage you. Hugs before drugs. Cuddles are wonderful ways of releasing good hormones. Maybe it's just like getting up and going in the bath. So if you want the bath, just ask for a bath. If you want to get in the shower, get in the shower. So as your labour progresses, things are going to be getting more and more intense. And you might have heard of something called the transition. So your cervix will normally open up to what we say 10 centimetres. But actually what 10 centimetres is where the cervix has opened all the way to the widest part of the baby's head. Yeah, so it's got all the way there. So the last little bit, so from about 8 to 10 centimetres, you can go into this like transition. And this is maybe where you might have been doing so well and you might all of a sudden decide that you might need some analgesia. And that's fine, and you just need to ask. You might find that self-doubt creeps in and that you don't want to play anymore, and that is normal, okay? So actually when you start to feel these thoughts, you can maybe take it in a positive way that, you know, your labour is coming to its peak in the intensity stakes. Because once you've got to fully, everything changes and things become a lot more comfortable and easier, and the whole feeling of the labour becomes more manageable, and as the baby then starts to move down and out, the second stage of labour, okay? But in this transition, sometimes people can get very upset, and they're going to need a lot of support and positivity around them. Okay, sometimes you might have got to that point and you're starting to feel a bit, oh, you know, I need something else. Maybe this is a good time to get in the pool if you're not already in it. Yeah, that little movement into the pool will actually help and might carry you over the top of this peak. And so that might all be what you need. You might surprise yourself. Now with my ladies, I usually say to them, start at the very sort of like basics when it comes to analgesia. So start with your own body's powerful ones. See if you can tap into those. Tap into them with your breath. Slow breaths out. So a slow breath in and an even slower breath out. And making sure you rest and don't talk or don't do anything in between those short breaks. You can wiggle your bum, you can change position, you can go to the toilet, because it's so important that you keep your bladder and bowel empty, because there's not a lot of room in that pelvis. And if you've got a full bladder or your bowel is full, then you know that's restricting the room for the baby. So you want to keep that empty. I would say in labour, every hour, whether you want to or not, I would get up and walk to the toilet. Now that walk to the toilet is wiggling your hips. You're squatting down on the toilet and you naturally release your pelvic floor. So that's going to help with the baby too, moving down. Emptying your bladder or your bowels, maybe you will, maybe you won't, but if you do, you're keeping that space available for your baby. So you're going to help your baby there. And then you're going to waddle back. Make sure you keep yourself hydrated. So if you don't keep yourself hydrated, it is going to affect your body, and your body's not going to be able to work efficiently. So you do need to just take a little bottle with a little squeezy top and just keep sipping on there. But remember, you keep sipping on the water and the fluids, you are going to have to regularly go to the toilet. So every hour, take your little waddle to the toilet. If you find that just using breathing techniques, you feel like you need something else, a little bit more help, then that's absolutely fine. Just ask. The next step would be to try the gas and air, the Entonox, and you can use those, and I would always say use them, give them a good go and use them until you really feel that you need something else. You might really surprise yourself at how little you actually need. But if you do need more, don't beat yourself up. If you need it, you need it and it's there for you. You just have to ask. It may be that you might want to use the pool, the Entonox, and your breathing techniques, and you're moving around, and that might be enough. Or again, you might find that you might need some opioids to help you. So your pethidines, your diamorphines and your Meptid. And these will all be explained in the analgesia video to follow. Okay, so like I say, never ever worry about asking for more, but give each step a good long try until you get to the point where you think, no, I definitely need something else. And you really might surprise yourself how far along your little birthing journey you can actually get. Your final option is your epidural, and of course, along with the opioids, that can affect the way you birth and also your baby as well. So you'll need much more monitoring and you'll be less mobile as well. But your midwife will be there to explain each one to you, and please do watch the video all about all the different options. So the next important person in the room when you are in labour, apart from yourselves and your baby, is your birthing companion, your birthing partner. So this person needs to be chosen wisely because they've got a massive job to do. So they are your positivity creator, they are your masseur, they are your feeder, they are the person that makes sure you drink plenty and often, and also takes you to the toilet every hour. They are your masseur. They are your general dog's body. They are your whatever with a big smile on their face. They are your hugger. They are your advocate. They need to be able to let us know what your wishes are for your labour. If you are concentrating on doing your job, which is giving birth, sometimes you might not want to speak. So this is where the birth companion comes in. They may want to tip water over you while you're in the pool. They may want to be your DJ. So you need to let them know what sort of music you want to play. They need to keep the mood quiet but happy. So they have such an important role to play. So do speak to them and do make sure they absolutely understand your complete wishes on how you need to birth. So I hope this video's answered some of your questions and has been helpful. I look forward to speaking to you in the next video, the second stage where the baby's coming down and out.